Hi everyone, welcome to the Body Manual. My name is Annabelle and I will be your physical therapist today. Here we're going to talk about strengthening the upper back. We've already talked about stretching out the pectoralis major. So if you imagine everything we do is in front of us, we're writing, we're carrying items. When we work, these muscles get worked out a lot. There's nothing behind us that tells us to activate these muscles in the back. So we all the more have to counter the forces here. So over time, most likely, nobody really stretches these muscles until it's kind of too late. The reason why this is called the Body Manual is things that we wish we knew in the beginning. So things like this could be prevented over time. It doesn't mean that it's too late if you are in this position. So go back to the previous videos and make sure that you follow those stretches that I've given so far. So in the back, your scapula, so your shoulder blades are these little triangles, right? They're just kind of free floating along your rib cage. So this is your spine here. So the muscles that hold the shoulder blades to the spine, one of them is the rhomboids. So they're in this angle like this. What I notice in a lot of our patients for shoulders or neck, these muscles here get very tight. So the reason why I introduced the body maintenance toolkit first is because before we even do all of these strengthening exercises, we need to loosen up the shoulder blades. If these muscles are in a shortened position and you try to do those exercises, you're not getting the most benefit from. So I'm going to get my back buddy and I'm going to target those muscles. Okay, so I will use this end and I will put this knob right between my spine and my shoulder blade. Okay, so as I've said, your shoulder blades need to freely move. I've had a shoulder injury, so I can tell that my shoulder blades don't move equally or symmetrically. And we'll talk about symmetry. Just because things are not symmetrical doesn't mean that there's something wrong. It just means that one side might be tighter than the other or weaker than the other, but we want to make sure that we're paying attention to both sides. Otherwise, one side will have pain or have some kind of symptoms than the other. So I'm gonna put this knob, remember, between my spine and my shoulder blades. This one I can tell is very tight, so I would focus on that. So my motion is I'm nudging my elbow forward, okay? So I can already feel that my muscles have loosened up and there's less clicking going on. Okay, so once I'm done doing that, I can go on with my strengthening exercises. Okay everyone, so what I want to do is I want to strengthen the muscles that do this. Mainly the rhomboid muscles. I have a resistance band here, and what I did was I wrapped it around the doorknob and just make sure that it doesn't hit the latch so it doesn't tear. Ideally, you want the door to close towards you. Okay, so what you want to do is you're going to pull and squeeze your shoulder blades back, okay? Just like that. And notice that I'm actually activating those muscles in between the shoulder blades. So I'm bringing my shoulder blades together. What I commonly see, my patients will say, I do that all the time. And then I say, hey, show me. So what they do is they pull like this, lead with their elbows. So what that's doing is it's rolling your shoulders forward, which defeats the purpose because you're trying to open up the chest. But when you're trying to do this with resistance, you're actually shortening the pectoralis muscles more. Just like that, which is what we don't want to do. We're trying to stretch that out, open this up, and strengthen the back. But also, I notice people lead with their elbows, so that's not really activating those muscles. And don't do it too fast. You want it controlled going back, opening up the chest, controlled coming forward. Allow your shoulder blades to move. Another thing that I notice is that people tend to lean back this way. So when people get tired, when the targeted muscles become tired, other muscles will take over. People will start doing this. Once you start to compensate, I want you to stop. That's why it's important for somebody to watch you do the exercises. You can do on your own. You can do this with a mirror, or I record myself so that I know if I'm doing my exercises correctly or not. Also, when I go to the gym, I notice people are doing the same thing. They're doing rows this way with a pulley or with the weights machine. Make sure that you're aware of those things that I mentioned, and it will lead you up to success. And lastly, people say, oh yeah, I do this workout all the time, but then they come in like this. So the purpose of the exercises are to make those muscles stronger, but you also have to learn to apply using them throughout the day. So if you go to the gym and do this all the time, but you sit like this, that's why I said be aware of your posture. You don't want to do this, okay? If you know me, you always see me trying to squeeze my shoulder blades together. I'm one of those people that always say I should have listened to my mom because I was like this as a kid all the time. Okay, so this is the chance to get those muscles stronger. So I hope you stay tuned for the next videos, and we'll continue to talk more about the posture.